called as Anchorage in orthodontics, which is one of the most boring. I wouldn't say tough. Dr. George said in the introduction is a tough topic. No, I don't think so. But it's a boring, dull topic. It's a beautiful, interesting topic for fixed orthodontic people. But for undergraduate level, for MDS entrance preparation level, it's actually a dry topic. Anchorage. What is Anchorage? Anchorage is actually a very simple topic. My aim today, the next 15 minutes, is to explain Anchorage in the most simple way possible. You have a plantain tree slanting down like that because of the weight of that banana. Now, how do you want to get that plantain tree tied onto something? I mean, how do you get it straight and erect? Tell me, how do you get it straight and erect? You have to tie it onto something strong, right? Something strong. Or will you tie it to another tree which is about to fall like that, guys? Will you do that? You want to get it tied to something stronger like a huge tree. Now, tie it onto a huge tree, yeah, you are safe. Now, what happened just now? You assumed that this big tree will not come forward. What was the reasons why you assumed that the big tree will not come forward? The reasons were simple. You know, it's a huge tree, huge trunk, huge root, multi roots going down. You know, it's deep rooted. You know, it's huge. You know, it will not come forward. So you tied it onto that bigger tree, which will not come forward. Does that mean that there is no force on that big tree to come forward? There is force on that big tree to come forward. If there is no force on that big tree, you know what? Dr. Sir Isaac Newton will move in his grave now. Third law. Every action has an equal and opposite reaction. It has to come forward, but it's not coming forward because it's thicker, it's bulkier, it has a bigger root. Clear up to here? Those are in video, at least show me a thumbs up and tell me, am I going okay? Perfect. Yeah. Dr. Vinny, I know you show thumbs up for before even I tell you show thumbs up. Thank you so much. Yeah. I have no clue why are you here. You're a pedologist, am I right? Oh no, I got it wrong. Sorry. Anyways, so you have a plantain tree, you want to tie it on to a bigger, thick tree. So that's the scenario we are discussing here. Now let's look at a patient. Severely proclined upper teeth, lower teeth. Patient in front of you telling that I don't like my smile, it's too proclined. Can you please take it in? Now, when you want to take it in, you take out 4 teeth, 4 bicuspid extraction. 4 bicuspid extraction. So this is upper arch, 2 bicuspids gone. Now you want to take the upper teeth back. When you want to take the front teeth back, guys, that molar will act as that big tree I just now told you. It's an assumption. It's an assumption by the orthodontist that molars are big, molars have multi-roots, molars have bigger root form, root number. Every way the molar area is strong. The premolar is also in front. So you have 2 teeth, 2 big multi-rooted teeth helping you to take the front 6 teeth back. Front 6 teeth is what? Single rooted 6 teeth back. You have multi-rooted teeth back there. So assumption is the molars will not come forward. Only the post anteriors goes back. That is our assumption. That's what we need. This is called anchorage. Anchorage is nothing but resisting unwanted tooth movement. Definition of anchorage is nothing but resisting unwanted tooth movement. What is the unwanted tooth movement? Unwanted tooth movement is molar coming forward. You don't want that. Patient is in front of you. Doctor, I don't like my smile. This is too proclined. I would like to take it back. Now you put elastics and this, that, you try to take it back. Instead of taking back, your molar came forward completely. Just assume your molar came forward completely. Patient looks still the same. Extraction space closed, patients look still the same. Are they going to be happy about it? So resisting that unwanted tooth movement is the definition of anchorage. Now, these days, MDS entrance questionnaire do not have the definition of anchorage and all that. Yeah, sorry to say, they have gone above that. They're not asking those questions anymore. Anchorage is divided into two, intraoral and extraoral. This is still coming as questions in MCQs. Intraoral and extraoral. What do you mean by intraoral? Intraoral means using your teeth and the alveolar bone as your anchorage. What do you mean by using the teeth? See, don't write down these points. Just listen to me. I'm seeing many people writing down. Just listen to me. All this will be elaborately explained during the main class. Don't worry. This is just an orientation class. Without even any writing down, I am promising that after this 15 minutes, you will be able to answer 5 questions. 15 by 5 philosophy will be proved tonight. Teeth. Teeth being used as anchorage. Let's look at this picture. Which all teeth are we planning to use as anchorage? We are planning to use the molar and the premolar. Molar and the premolar. Some people use second molar. Second molar. Some people use third molar. That's a lot of teeth back there. Guys, this is a tug of war. This is a tug of war between posterior teeth and anterior teeth. Just look at who is going to win. If the posteriors are strong back there, only the front teeth can go back. Back teeth cannot come forward. So that strength back there depends upon the number of teeth, the root size, root form, number of roots, and all that. I covered all that already. The strength back there is determined by the number of roots. The 3-rooted molar is definitely stronger than those single-rooted central incisor, lateral incisor, and all that. The root size, root form. Just assume that big tree and the plantain tree, guys. That's why I started with that. So all this will be a factor to use teeth as your anchorage. Now, coming to this is a question that has been asked multiple times in MCQs. Identify this. I've already given the answer, transpalatal arch. But recently, I found a new trend in the exam question pattern that they are even asking what is Gauge-Gurian arch. Gauge-Gurian is nobody but the person who found out this transpalatal arch. But the recent question paper was identify this. And in the answer, there was no transpalatal arch. They only had Gauge-Gurian arch. I'm really sorry, guys. That's not the way to confuse a undergraduate, but that's the way they're doing it. This is not even NEET. I'm talking about national board. They've done that Gauge-Gurian thing. The reason I know is 2 years before it was the death anniversary of Dr. Gauge-Gurian. So because I know this because his student was my HOD in New York University. That's why I know. I don't know this Gauge-Gurian. He died in 1982 or something. Yeah. So, but I know his student. But recently a question came, identify this appliance, and the answer was only Gauge-Gurian. So Gauge-Gurian, do not forget, they might keep on repeating all those crazy stuff. That's transpalatal arch. What is transpalatal arch doing, guys? Transpalatal arch is just connecting the molars together, making it little more stronger. As if that big tree, which you connect that big tree to another big tree, make the whole back there very strong. For that plantain tree, I know you won't do all that. But when it comes to orthodontics, you might have to do all that. Make the back area stronger. Gauge arch or transpalatal arch. Next one is something called as NANS. I can't see my slide because of the chat window. Yeah, NANS holding arch. NANS holding arch is kind of a slight modification to the Gauge-Gerian, wherein you have a NANS acrylic button. The button is kept there on the palate. The button is like holding right on the palate. The molar cannot come forward. It's stuck there. So that's another method to improvise on your anchorage. But let me tell you, these are all intraoral, inside the mouth, obviously, and these are all aiming at teeth. Within the teeth, they are like connecting the teeth together and all that. Now, about alveolar. See, I'm still covering intraoral, inside the mouth. Teeth, I covered. Teeth, I covered about the root number, root form, root size, done. I connected that together, done. With Gauge-Gerian or NANS or whatever, done. Next is alveolar bone being used as your anchorage. Okay, now look at this picture. If you can see my mouse, can you see this small little implant there? That's a small mini implant placed onto the alveolar bone. And look at the next picture carefully. The elastic chain is connected to the alveolar bone, or the elastic chain is connected to the mini implant. Dr. Deepa here is having frowns here. Is it that you can't see it, or am I not clear, or am I too quick, or you're not using your glasses? Am I okay? Thumbs up from people here. Those who are in video, at least show a thumbs up. Am I going okay? Deepa is frowning so much. I felt a little sad for her. That's why I asked that question. As if she can't understand anything or she can't see anything. If it's like you can't see anything, others would have already commented. But I don't see any major negative comments in the chat box at this point of time. Am I going all right, guys? Those who are in, yeah, thumbs up. Perfect. That helps. Dr. Vinny, you know me. For the last 10 months, you know me, Dr. Vinny. All right. So mini implant, the forces are on to the implant. Not even a pound of force to my molar. Is there any force on my molar? Nothing. Will my molar come forward? No, because the elastic is stuck to the alveolar bone or stuck to the mini implant, which is in the alveolar bone. And the implant is not going to come forward, guys. Implant is just not going to come forward. So, temporary anchorage device or TAD. Questions have been asked in all the way around in the last 5 years of NEET. Full form of TAD has been asked. What is TAD? Everything has been asked. It's a temporary anchorage device. Trying to get an anchorage temporarily. Okay. So there's one more picture here. You put the elastic onto the alveolar bone or onto the mini implant. No forces on my molars. Will my molar come forward? No. No forces, zero forces. This is also termed as absolute anchorage. There are questions asked in that way also. Absolute anchorage is being possible with what? That's also being asked in entrance papers. Next, teeth, intraoral, using the teeth and using the alveolar bone done. We are now trying to come to extraoral. What do you mean extraoral? Outside the mouth. Outside the mouth is very simple. Just tie everything and put the elastic chain into some tree or some pillar on the wall. Oh, come on, that's not possible, guys. You have to tie it on something practical, and that is called as a headgear, where we use cranium. The cranium as the anchorage, that's called headgear. And when it's from the cranium up here, it's called high pull headgear. Pull is from high above, high above, high pull headgear. Now, why am I specifying or emphasizing on these points? Because the questions can come that way also. What is a high pull headgear? High pull headgear is nothing but the pull is from up here, from the cranium. But this is a pull from down there, the neck. The neck muscles are used and pulled down. It's a low pull. Low pull, are also called as a cervical pull. All this is making sure that the molar is not coming forward. Molar is not allowed to come forward because you have all this face bow and all that, making sure that the molar is taken back. Now, to confuse you more, there is one more called using the forehead and the chin. Forehead and the chin is being used as the anchorage. Can somebody here? Yeah, I think it's high time somebody come to the chat box and type in. And you might sleep off here. It's already into 14th minute. Come to the chat box and tell me, when do you use forehead and chin as your anchorage? I mean, why do you need this too as your anchorage? You're always thinking about pulling back. But when do you use this as your anchorage? Can somebody come to the chat box and tell me, when do you use forehead and chin as your anchorage? Forehead and chin is used as your anchorage when you want to bring the maxilla forward. Yes, somebody already answered it. Reverse pull. Reverse pull. You want to bring the maxilla forward. When you want to bring the maxilla forward, anchorage is this and this. And there is a pole here, and you bring the maxilla forward. That's the forehead and chin being used. These are all extraoral. We are talking about out of the mouth. Inside the mouth, I cleared. We're talking about out of the mouth. Now, what is this condition? Diastema closure. Two central incisors with a huge gap needs to be closed. How do you close that? You can put two brackets, put an elastic, and bring it together. What is happening here when you bring it together? When you bring this together, tell me, is there any anchorage here? Which tooth is stopped from moving? No teeth is stopped from moving. Both the centrals will move. Both the centrals will move. So what is the anchorage here? There is no anchorage. Both the teeth moved. Nobody is stopped there. This is called as absolute anchorage. Reciprocal anchorage. Reciprocal anchorage. Reciprocal anchorage. Nobody is asked to stop. Sir Isaac Newton completely being given the freedom. Every action has an equal and opposite reaction. Guys, in orthodontics, many times when you go through this Sir Isaac Newton's third law, many times you really feel this fellow was sitting under a coconut tree instead of an apple tree, because that law is very irritating. In orthodontics, it is very irritating. You move something, somebody else will move. So that is reciprocal anchorage being explained here. Now look at this scenario. I think this is the last scenario here. What is this? Can somebody come to the chat box and quickly tell me what is this? Lip bumper. Perfect. Sneha. Sneha is a pediatric dentist. Sneha, thumbs up? No. Okay, great. Great. So lip bumper. What is lip bumper doing? Lip bumper is a device that is kept in the lower arch where the lip musculature is used to push the molar back. You can see this side picture here. Side picture here. You can see the bumper here. The lip musculature is taking it back. Perfect. They already answered muscular anchorage. That is muscular anchorage. Muscle is being used for anchorage. So that Galaxy A71 that answered muscular anchorage, you have to answer one more question now. Which muscle are we talking about? It's actually the mentalis. It's actually the mentalis we are talking about. So muscle being used as your anchorage to keep the molar back there or push the molar back. Guys, this is just a tug of war. This is just a tug of war between the posterior unit and the anterior unit. You have to decide who is going to win. I think in this picture, the elephant might win. It'll be a small margin, but the elephant will win, right? Don't you think so? It's a tug of war between what you're trying to do, and that is anchorage. Guys, I am concluding here with this picture which I started, the patient which I started for bicuspid extraction, because the patient came to me with a proclined teeth. I hate talking pure entrance questions, guys. Those who are listening to me, I want them to understand basics of orthodontics also. There is a patient in front of me with a complaint of proclined teeth. She needs a flatter smile. I took out 2 teeth in the upper, 2 teeth in the lower. I'm trying to take the teeth back. When I try to take the teeth back, I cannot afford the molar to come forward. What happens if the molar comes forward? I will not be able to give her a flat smile. Molar should not come forward. Do whatever you can to prevent molar coming forward. You will have to take x-rays. You'll have to do all the cephalometric analysis. That's another topic coming up pretty soon. Cephalometric analysis, one of the most dull and the boring topic in orthodontics, will be cleared in this focus group soon by myself. Do not worry. All the questions in cephalometrics will be covered. That's my guarantee here. Guys, I'm guaranteeing you one more thing. You forget about orthodontics. Leave it to me. Just listen to me. Forget about orthodontics. You worry about other stuff. Yesterday's dental material, oh my God, she's talking about calcium phosphate. She was so good. She was so good. But I am not that good to grasp. So you guys better be clear about all that stuff. Forget orthodontics. It's nothing. Leave it to me. If you're with focus, I guarantee you orthodontic questions will be done. Maybe a lot more of pediatric orthodontics also done. So with all that analysis done on this particular case, with that anchorage being controlled nicely for that particular case, I could get a nice flat smile for her. Otherwise, it will be a disaster because she came to me for a flat smile. And if I cannot take the front teeth back, and if the back teeth comes forward, I may not be able to give this kind of a result to this particular patient. Guys, I'm done in that time slot of what given to me. And I'm concluding here with that 15 by 5 principle again. 15 minutes of explanation. You should be able to answer 5 questions. Let's look quickly at question number 1. Anchorage potential of the teeth depends on factors like number of teeth. Anchorage potential of the teeth we are talking about. Anchorage potential of the teeth depends on factors like number of teeth. I already covered that. Yeah. More number of teeth back there, it's better. Use second molar, third molar. Use more teeth back there, it's better. Root form, the bigger the root form, the better. Root size, I told you. Number of roots, multi-rooted back teeth there, it's all good. Then what is the answer then? Now comes the last answer. So obviously the answer for this question is all of the above. Name this appliance. Covered it all. I told you 15 minutes of explanation, you should be able to get it. Name this appliance. Nan spelled large. Is it Nan spelled large? No, it has to have a button. Is it coffin spring? Coffin spring comes under removable, comes under expansion and removal. I'll talk about all that later. Arch expander, those are those expanders. But let me tell you, this question is from National Board. It's actually a very tricky question. Arch expander number C, the C, arch expander is a tricky question because you look at the U loop here. Look at the U loop here. You expand it a little, you will get little bit of expansion on the molar area. So answer is not very bad. It can be considered as an arch expander, but it will be a dendo-alveolar expansion, no major splitting up of the palate and all that stuff. So the answer has to be the Gaussian appliance or the TPA. TAD uses what as anchorage? TAD is temporary anchorage device. What does it use? Does it use teeth? No, right? No, right? No. So back of the neck, come on, no. That's what? Cervical pull headgear. Cranium, high pull headgear. So the answer has to be the alveolar bone is used for TAD. Which among the following appliance comes under muscular anchorage? I covered all that. Gaussian arch? No. Gaussian arch is just connecting the teeth. Nothing to do with muscular. Distal shoe. Distal shoe is what? Oh, come on. Tell me. Somebody come to the chat box and tell me what is distal shoe. The red tape shoe you just got? No. Distal shoe? Space maintainer. Perfect. Distal shoe is just a space maintainer. It has nothing to do with all that. Band and loop, another space maintainer. But the answer is obviously lip bumper, which is muscular. But here I want to ask you one question. What are the other muscular anchorages we can use? Think and come to me later. Let's not complicate now. Last question. Diastema closure is a classical example of, I covered that. 15 minutes, I covered that. Alveolar bone anchorage. No. Diastema closure is never an absolute anchorage. Alveolar bone is like an absolute anchorage. No movement whatsoever. Stationary is also something like an absolute where you have a bodily movement of the anchorage. Simple anchorage is again a removable appliance. Tipping movements comes under simple anchorage. So the answer has to be reciprocal anchorage. See, I didn't want to ask you this. I didn't want you to come and answer what is A, B, C, D and all that. My purpose was just to tell you that 15 minutes of explanation, you should be able to get 5 questions. 5 questions done here. 5 questions answered here with 15 minutes of explanation. 15 by 5 principle is what I follow. And so 1 hour you spend, you should be able to answer 20 MCQ questions. Whether it's your own reading, whether it's focus, whether it's some other competitor, I don't care. But I personally feel that you should have some kind of a coaching class like this for 2 things. 1, you will be more systematic. You know that I have to get into the class at so. Otherwise, I know a friend's party coming up, baptism coming up. Things will just go, guys. You got to be focused. Why they gave the name Focus. So be there, be with us. Those who are interested can join. There's no compulsion. Thank you very much. Once